When is the best time to get the flu shot?
Yesterday. Flu season is already here. We have been diagnosing so many patients with the flu, and some also have coronavirus. So we're having some with coronavirus and the flu at the same time. But the good news is the flu shots, they're out right now, and they are very effective. If you can get your flu shot, go ahead and get it as soon as possible. Go visit your medical doctor, your nurse practitioner, or even your local pharmacy. But the take home is get that flu shot, because that's some protection that has been proven to work for years and years and years.
Dr. Quinn, even if somebody is like fit and healthy and they say, oh, I don't get shit, I don't ever get sick, so I don't need a shot, do they still need to get the flu shot?
Most definitely. I mean, the take home is the coronavirus pandemic has taught us one thing, if not anything at all: vaccinations work. Because remember, early on in the pandemic, 2 years ago, people were losing their lives just every single day. But now, since most people have been vaccinated, most people have protection. Because when you get your flu shot, what happens is you get those antibodies in your bloodstream. If you come into contact with the flu, you can fight it off. You can not get so sick and have much better chance of not ending up in the emergency room, the hospital, admitted, ICU, and or losing your life. Getting that flu shot is such a smart thing to do. And this flu season has already started off aggressively.
Dr. Quinn, is there a scenario where someone should not get the shot, like maybe if they just had the flu or if they have certain medical conditions?
Yes. Well, if you have certain allergies, most of the flu shots are prepared with eggs. As far as in the preparation, you would let the medical provider know before they would give you the shot. That's part of the questioning that we do before we give this vaccination. But also, if you've had an allergic reaction in the past with some of the ingredients of the flu shot, you would make that known as well, and you would not receive the flu shot. But overwhelmingly, the flu shot, it's something that should be done. Now, if you've had the flu, you have some protection against the flu, but if it's been over 2 to 3 months, it's not a bad idea to go ahead and get that flu shot again, because different flu strains are coming out, and maybe the flu you had before might be a different strain than the current strain. But overwhelmingly, getting that flu shot is a very good thing to do to give you that protection that you need, especially with the fact that the coronavirus pandemic is not over yet, and you don't want to be someone to get coronavirus and the flu, which can be even double as far as the danger.
Now, Dr. Quinn, you mentioned the coronavirus. Can people get the COVID vaccine and a flu shot at the same time?
Most definitely, and we've talked about that on this programming before. The CDC, they made that decision about a year ago, and it's actually a very good idea. If you're not up to date on your coronavirus vaccinations and or your boosters, and you need to get your flu shot, you can go to your local Walgreens, your Walmart, or your medical provider, and they will give you those shots the same day. They'll just do it in 2 different arms. But at the end of the day, you'll get that protection that you really need.
Well, good advice, always good advice from our friend Dr. Timothy Quinn. Thank you, sir, for being here. We'll start checking into flu shots right now. Thanks.
Sure will. Thank you.